spine.
Drop that shoulder.
There we go.
We have a patient here, Paul.
Hello, Paul.
Hello.
And what's your complaint today?
Oh, my neck hurts.
Okay, very good.
John Bedaines is conducting a chiropractic examination. He compares the lengths of Paul's legs and finds a difference. Next, he makes adjustments in the alignment of Paul's skeleton. According to the theory, Paul's leg lengths should become even with his neck pain cured. John Bedaines is a fully trained, experienced chiropractor, but he left the business after 7 years when he realized he had to face up to the fact that his profession made no sense to him.
This is an activator.
Yeah.
It doesn't involve bone cracking or joint popping. If I activate it, there's a...
It's just a little tap.
That's a little tap. In fact, I can adjust that down to...
I can't even feel that.
That's correct.
Chiropractors adjust subluxations. A subluxation, is that some kind of displacement of bones in the spine?
A subluxation is what a chiropractor defines as a problem.
In other words, it's a term that's used in many, many different ways. Huh?
Correct.
And now, historically, when Palmer invented this, introduced this term,
Right.
he was talking, was he, about some kind of blockage of some life force that was coming in from the universe?
What he called nerve interference, and it was a life force expressed through the nerves, and that was blocked. What he called nerve interference, usually by a bony displacement.
Chiropractic, which literally means done by hand, was invented by Daniel Palmer in Davenport, Iowa in 1895.
Do you want the cause of your disease removed and get permanently cured in the quickest possible time? Chiropractic relieves pressure on nerves. The cause is removed and perfect health established.
Palmer, a spiritualist and magnetic healer, said that chiropractic was revealed when he cured his office janitor of deafness. The janitor said his deafness had started when something gave way in his back. Palmer takes up the story.
An examination showed a vertebra racked from its normal position. I reasoned that if the vertebra was replaced, the man's hearing should be restored. With this object in view, I racked it into position, and soon the man could hear as before. In that adjustment originated the art of replacing vertebrae.
Subsequently, a large theoretical structure and industry have been built on the basic idea that pressure on spinal nerves causes disease. Palmer believed the pressure interrupts the flow of what he called innate intelligence, or life power, from the brain. Nowadays, the language may be a little different, but the basic idea is the same.
We are concerned about the relationship with the ability of the nervous system to express itself fully throughout the body, as it particularly can be interfered with at the spinal level. The chiropractor is concerned about aberrations in the spine, minor misalignments that may not seem consequential to other providers, that have profound impact from our experience as chiropractors on the health and well-being of the patient.
30 years ago, an anatomist tried twisting cadaver spines around, but couldn't figure out how to obstruct the nerves, short of actually breaking something. In fact, our vertebrae give the spinal nerves plenty of room. So now, chiropractors say the effect is indirect.
The pressure may not be on a spinal nerve root, or the pressure may not be on a spinal cord, but it may be a disturbance that changes the musculature, that changes the pattern of cerebrospinal fluid movement. It may be a change in the positioning of a vertebra that begins to compromise and compromise a joint level, produces swelling that in turn produces pressure on a nerve root. So the early concepts of chiropractic of being direct nerve pressure have given way to concepts of indirect pressure.
Hi, Kimberly.
Hi, Dr.
Nice
Rowe.
to see you again
Nice to
today.
see you too.
So tell me, how did you respond to our last visit?
Really good, actually. I was feeling really good after, thank you.
And since then, you've been feeling?
I've been a little sick for the past week. I've been sick.
You've been sick. Tell me about that.
I've got sinus congestion, a little headaches, and fatigue.
And how are you feeling now?
About the same. I'm still got some sinus congestion, and I'm still tired. It's not really getting any worse or any better. It's staying the same.
Okay, well, I'm glad you're here, and we'll take a look at your spine and see how you're really doing. Okay, now we're just going to feel how your spine is moving, so I'm just going to... Art, you can just let me feel the motion here. There we go. I'm feeling for her spine to have a free, even motion between each segment. And if I get to a segment like that one right there, that's not moving freely,
It's tender.
and then I'm going to ask her if it's tender. Well, she just volunteered that, but that would indicate to me that that's very likely subluxated.
Stephen Rowe now confirms the subluxation with his nervoscope. It compares skin temperatures across the spine and has a long history in chiropractic.
I'm looking for subtle differences at specific levels.
Palmer said disturbed nerves can show up as imbalances in heat. It's reminiscent of the Chinese concept of yin and yang and has equally little basis in anatomy. Having located Kimberly's subluxation, Stephen Rowe now uses an X-ray to plan the adjustment procedure.
I'm looking for factors like whether she has a proper curve, proper neck curve, a proper thoracic curve, and a proper lumbar curve. Then I'm looking intersegmentally between each segment, intersegmentally, as to how they align. She has what's called a base posterior sacrum, where her sacrum is misaligned in relationship to the fifth lumbar, and that's what we'll be adjusting on her.
This, for a chiropractor, would be a curve that needs to be fixed. It needs to be straightened out.
Now, is it possible to straighten it out with the
methods that people
adjustments using people's
Well,
hands?
like I say, I don't think that it is. I don't think that major changes, in spinal configuration can be made. But that's not the point. The point is that it's never been demonstrated that the shape of the spine has anything to do with disease or health.
Good. Just bring your pelvis a little back.
Nevertheless, in a procedure repeated many times over in chiropractors' offices across the country, Kimberly gets her spine adjusted.
Okay, Kimberly, just relax, nice and easy. Let that belly go forward. There we go.
I feel great.
The popping noise that joints can make is often interpreted by chiropractors and patients to mean the bones have moved. In fact, it's just dissolved gas being released in the joint fluid.
These joints are similar to the joints in my finger. My finger has two little bones and is wrapped, there's a space between it like this, and that's wrapped in a joint capsule with fluid. And when you pull them apart, as I did there, it makes that popping sound. But, of course, my finger hasn't changed its position at all. Well, the same thing happens when you manipulate the spine. Patients believe that the bone was out of place, and that noise
snapped back into place.
Signals back into alignment.
Yeah,
and
into
because
alignment.
Exactly, because that's what the chiropractor.
But you're saying you really can't change the position of the bone by this procedure that results in a crack.
Not by that. Yeah. Not by that. But otherwise, every time you cracked it, you might be in danger of coming apart.
Lift up your right arm, please.
Kimberly gets a second adjustment.
Okay, just right there. There you go. Drop that shoulder. Excellent.
As a result of this, I would expect some of the symptoms that she initially talked about, her congestive, sinuses, the heaviness in her neck and in her head, to be reduced.
Chiropractic is a regular way to stay healthy. I get adjusted on a regular basis, approximately every 2 weeks to 3 weeks, depending on how I feel and how everything's going. If my adjustments are holding well, then we can make the time between adjustments last a little bit longer.
Robert Barrett is a physician who believes, with Wally Sampson, that patients like Kimberly are confusing cause and effect. The treatment is unconnected to health, he says, and chiropractic bears no relation to reality.
The chiropractic theory of manipulation as being curative of disease or in terms of diagnosing disease is based on a false premise. The premise is that there's some kind of vital force flowing around the body, as yet undefined and unquantified and undetectable, that they claim they can manipulate by manipulating the spine.
Here's the leg measuring procedure again.
By comparing the like surfaces here, I get a right short leg. That tells me that there's an imbalance in the system, and it's a go-ahead to keep it analyzing the patient, and I know where to go with that now.
The imbalance needs adjustment.
This is an Activator 3. It's the third generation of development, and what we've done here is made an instrument that has an ultra-fast thrust. And we know that if we can activate the nervous system faster, then we don't have to push it as hard. We don't have to get the cracking noises that are often associated with a chiropractic adjustment. But we're accomplishing the same thing. And then I go ahead and check the leg length again, and the legs are now even. That tells me that I've made a good correction.
If someone says they can measure leg lengths as being different, and that's the basis for their diagnosis, what is the diagnosis? First of all, it's normal to have leg lengths that are of different lengths. That's true in almost everyone.
Lift your head up, back down.
The length of the leg is not determined by the spine. It's determined by the bones of the leg. And by manipulating the spine or the back, you're not going to change that, because those bones aren't going to change their length by any form of manipulation, unless you break them.
It's easy not only for the patient to be fooled, but the chiropractor too.
Small changes in this position like this can fool the practitioner if their expectation...
It's longer over here than it is over there.
Correct.
If patients feel relief, it's fair to ask if it really matters if chiropractic makes sense. But there is one problem. Some forms of chiropractic involve violent manipulation. Many techniques concentrate on the nerves of the neck, including this one called toggle recoil.
The upper cervical spine specifically, which is what this technique focuses on, is the only area of the body where you can directly access the nervous system. It's got, and this is just physiology and neurology, it's got 400 to 500 times the amount of mechanoreceptors, proprioceptors, things of that nature that go directly into and affect the way your brainstem functions. So if there's a problem in that area, we want to know about it.
The chiropractor believes this patient's neck bones are at the wrong angle. They must be adjusted.
You see some lines drawn in here, and there's a number. It says 26 degrees. That's giving me an idea of the atlas plane angle. Go ahead.
Chiropractors have always maintained that neck manipulation is safe, with maybe 1 in a million procedures causing injury. No worse than many other health treatments.
Scoop right into my contact. I'm going to set the headpiece. And that's it.
But beginning in the mid-1990s, with this book by an injured patient, the safety of neck manipulation has been increasingly questioned.
Going to a chiropractor and having your neck manipulated is extremely dangerous. Now, can many people have it done and not have a bad outcome? Sure they can. Do you want to take that risk, is the question. Do you want to be the one who gets the paralysis? Because every year there are hundreds of people who get their necks manipulated, have their vertebral arteries torn by chiropractors, and end up paralyzed.
Many chiropractic adjustments are made by first laterally flexing the head and turning it like this.
This manipulation puts a severe strain on one of the 2 vertebral arteries leading to the brain.
When you move the neck suddenly, when you take it to tension and then move it suddenly, you're giving that little extra tension pull on the vertebral artery, and you can create a little tear which repairs itself with a blood clot, and that blood clot can then dislodge and go up to the brain and deprive the brain of oxygen, and that's called a stroke.
It's very hard to know how often this type of stroke is caused by chiropractors. Good statistics don't exist. But a recent Canadian study estimated that 20% of all strokes caused by artery damage could be a result of neck manipulation. That translates into more than 1,300 strokes a year in the U.S. There are many types of chiropractors with many different techniques, but they're all based on one idea.
It's your position that it doesn't matter what kind of chiropractor you get, what special way he or she might have of dealing with your problem. None of them is going to work.
It's my position that they're all self-referential. In other words, they define a particular problem that incidentally has never been, verified to be a problem, and then they have their methods of locating that problem, and then they have their specific methods of fixing it. So it's like a closed loop, and so it always works because you're just talking to yourself.
There is no scientific basis for what chiropractors allege they are doing. It is totally based on a religious belief system. And as long as you call it that, fine. But don't call it healthcare. And don't call it a form of science, because it